Hello, my name is Tori Whitaker Martinez, and I'm the senior editor for Infection Control Today. And today I am here with Dr. Stephanie Alice Baker, who is going to talk about the appeal of anti-vaccine influencers during the COVID-19 pandemic. So thank you so much for being with me today.
Thank you for having me.
You're most welcome. So, would you provide some insights into the factors or strategies that anti-vaccine influencers have used to gain traction and influence during the COVID-19 pandemic, and why you think these approaches have been successful in certain communities or online platforms?
Sure. I think, first of all, it's probably useful to say how influencers were already appealing to health communities and alternative health communities prior to the pandemic, and then perhaps looking at what was novel during the pandemic as well. So, if you see the way in which a lot of influencers have built authority and influence online, there are many common strategies and ways in which they present themselves to appeal to a broad audience and actually to build a quite loyal online following. And a lot of this is structured around what we term micro celebrity. And this is not only a noun to describe a category of people who achieve a degree of fame online, but it is actually a verb to describe the presentation strategies and more particularly the self-presentation strategies that influencers use to appeal to an audience. And so what we saw prior to the pandemic is that primarily this was achieved in three ways in the alternative health and wellness space. And this included the presentation or the impression of being accessible to their audience. And one of the ways in which this is achieved is through using the same online platforms that their audience uses, having a direct mode of communication. So the possibility that they might reply to their audience or create a Twitter poll or ask their audience direct questions. And it gives this appearance that they are equals and friends, both symbolically and quite literally in some cases. And the second way in which this is achieved is through authenticity, appearing as though they are genuine and real and speaking their truth and not mediated by these authorities and institutions, say the way that a medical practitioner would be regulated, say by a board. And thirdly, it's really this idea about autonomy, which ties into the others, but it's about being independent and very much again free from authority and the people who control the mechanisms of the mainstream media or, for example, the quote unquote medical establishment. And together these three self-presentation strategies make many influencers in the alternative and health and wellness space very appealing. It creates this sense of intimacy and trust with their followers in a way that you wouldn't really feel with a clinician or therapist who's certified, where there's a degree of distance that is required in many instances. Now, we saw many of the same techniques used in the pandemic where influencers would try to present themselves as being independent, as being autonomous, also as being authentic, as speaking their truth to power, and as being accessible, talking directly to their followers. But one of the key differences that we noticed throughout the pandemic is that many of the influencers in the health and wellness space were actually using a lot of QAnon discourse, so a lot of collective messaging to appeal to their audience. And this would make the personal wellness journey that many individuals would subscribe to more of a collective journey. And these are terms that we're very familiar with now, such as the Great Awakening and collectively draining the swamp and the types of cryptic crowdsourcing that people would collectively engage in. And we became used to phrases, where we go all, we go one. And so that was one of the key differences, is that this individual wellness journey was very much supplanted during the pandemic by a collective journey, which I think gave the anti-vaccination movement in particular a lot more power, because people felt invested in a common cause and a common movement.
Yeah, very good point. It was terrifying at the time, and it still is because so much of that information is not true, and yet people just soak it up. The spread of vaccine misinformation and hesitancy has been given a significant concern during the pandemic. What role has anti vaccine influencers played in amplifying these doubts, and how have their messages contributed to vaccine hesitancy among the public? Not just COVID, but all vaccines.
Yeah, so I think there's 2 points there. I might answer the last one first. We have seen from many studies that, as you mentioned, there has been a drop since the pandemic, not only in acceptance of the COVID vaccine, but actually across a lot of pediatric vaccines and routine vaccinations, which is obviously very worrying because we already have issues in terms of the MMR, measles vaccination being increasingly popular among the anti vaccination movement. And as a result, measles is spreading in many countries where previously it was eradicated. So that's obviously one big issue. I think the first issue is a bit more complex. And I think there's a couple of ways that anti vaccination actors were able to actually both amplify their message, but also recruit actors. And I think you need to divide some of this as being what was obviously very intentional and instrumental, what we'd often refer to as disinformation versus misinformation. And what I noticed in my own research is that there were a highly networked group of individuals who were deliberately seeding and amplifying disinformation. They would often cooperate online, amplifying each other's messages, but they actually networked heavily offline as well, which is quite interesting. So they were presenting at one another's conferences. They had a strong grassroots base. Unsurprisingly, in some areas, that there is a prevalence of new age alternative health communities, but also in some communities where there were cultural concerns around vaccination, and particularly around religion and race. And that was very problematic. And again, I think it's important to not underestimate the role that this grassroots activism plays, because we so often think in today's digital environment about most of this happening online, and there is a lot online, but a lot of this also happens in tandem offline and gets a really strong hold in certain communities where a lot of the savvy influencers are actually able to target specific communities on the basis, as I said, of race or religion or perhaps gender, especially among women and mothers, for example. So you see a lot of that happening, and it's very savvy. In an article that I have written with a colleague, which should be published any day, it's part of a special issue, so I'm not entirely sure when it's coming out, but we actually uncovered a very strategic influence operation where there was one influencer in particular who was creating a meme war around anti-vaccination messages. And he was not only creating memes that he would tailor towards specific issues to keep the memes relevant. So, for example, when the trucker convoy was happening, he would jump on that. And when, for example, Djokovic was prevented from playing in the Australian Open, he would jump on that. And there were a lot of memes that were tailored to, as I said, specific issues to make them relevant, to make them more spreadable. And this influencer was actually deliberately not only creating these, but sharing these with his followers, which were encrypted in private newsletters. So they weren't even in the main newsletter, they were in a newsletter, that he was then sharing and deliberately calling on his army of followers to spread these. And so it was really interesting to see how savvy a lot of these influencers were. And as I said, I think the takeaway was both that it was online and offline. It was highly networked. So it wasn't, we often think of influencers as these individuals who brand themselves, but these were individuals, but they were working as a network. And just to see the lengths they were going to actually spread their messaging in the anti-vaccination space. So that's what we noticed there. I think there was another group of people who, for various reasons, became cynical of the quote unquote official narrative, and in particular, the public health messaging. And I think a lot of those groups of people or individual users were very susceptible to the more moderate anti-vaccination influences because they doubted the official government message. And then if they expressed a doubt, they were often ridiculed. And that tended to push them further right or towards more of a libertarian mindset. And so that's another group that I very much noticed being susceptible. In this case, I think more to misinformation, possibly, a friend sharing something, but they weren't necessarily being targeted by these groups in the same way as the first groups that I mentioned. But they'd be susceptible to the messaging of influencers because they were already quite skeptical of the government message and just found themselves going more down a path that we would now very much associate with right-wing talking points or a kind of libertarian mindset.
My question is always why? Why do they do this? Why do they insist on saying these things that they must know that are wrong? What is their agenda? Is it just to get everyone on the conservative side? Is it to go against the establishment that they see as this evil background? I mean, I've been following this for all these last few years and even before with the regular vaccines. So I'm baffled. I don't understand why. Do you have any insights on why?
Yeah, so it is always difficult to know definitively what someone's intention is. And I think there's a couple of ways in which we can try to deduce what their intention is. The first I would highlight is that influencers in general are those who achieve a degree of fame online, primarily commercially, but we shouldn't forget that also some influencers primarily use their fame for political ends or also for social ends, just for a degree of flame and clout, for the lols, right? And so usually people will fall into one of those three, possibly two of them, right? So commercial, political, or social. And I think the other interesting aspect to notice is again comparing what we saw during the pandemic to what was occurring before. And this is where I feel slightly fortunate that colleagues and myself were already studying this area intensely prior to the pandemic. So we were already able to see some of the patterns. And one thing we really noticed is there was already a strong way in which many of the influencers in the wellness space achieve fame by positioning themselves as anti-establishment. Now, I think it's easy in today's environment, especially post-pandemic, to be very cynical and to think that people were doing this just for profit. But actually, in research that I conducted with a colleague on these, we call them lifestyle or wellness gurus. My impression is that a lot of these influencers did, prior to the pandemic, have genuine interest and conviction in the information they were sharing. I think many were critical of GMOs, critical of big food. The big pharma aspect they dabbled in, but it didn't seem to be the prominent message. I think a lot more of it focused on processed food. For example, the food pyramid that people were skeptical of. And I can really sympathize with that because I think there is a way in which many people who take an interest in health feel as though they've been sold a lie. That actually, when you look at the big food companies and corporations, that it has really been about profit and trying to deceive consumers through advertising. And I am sympathetic to that view. But I think the danger is then once you've got that mindset, it's very easy to use that then to approach anything that is seen as big and powerful. And so, for example, when you look at somebody like Robert Kennedy Jr., he on his website positions himself as the defender, but it's the defender against big food, big pharma, right? And there's a list of bigs, there's about 6 he has. And so you can see the slippery slope where some position that's very understandable then becomes a lens through which to understand and view the world more generally. And I think that's where we can get ourselves into dangerous territory.
In addressing the appeal of anti-vaccine influencers, how can public health authorities, healthcare workers, and their organizations collaborate with social media platforms, tech companies, community leaders to combat this misinformation, this disinformation, and promote vaccine education and uptake during and beyond the COVID-19 pandemic? Because we still have a lot to do.
Absolutely. I think there's a few things that health professionals and medical professionals can do to combat it. One is actually through using the strategies of influencers themselves. And I think this can be achieved in a very sincere way by using, say, for example, whatever social media platform they're comfortable with or where they feel as though they can reach an audience to actually share accessible health information and to basically generate that parasocial relationship that a lot of influencers have with their audience, but as a vehicle to disseminate trustworthy, reliable information. I think there are some people who already do this. Dr. Mike, I think, is a very good example of this. And I know he has a huge following on YouTube, for example. So that's one thing I'd say people could do. I think another really important thing to do, whether it is a medical professional or a government, is to be very sincere about what we know and what we don't know. I think one of the unfortunate aspects of the pandemic, if we're to use hindsight to reflect on public health messaging, is that it only takes something very minor for people to lose trust and faith in institutions. And there are many examples where I think the messaging could have been better, whether it was shielding things from the public, assuming that we knew when we weren't entirely sure, which is very understandable when it's a new virus and it's emerging and evolving. But I think being honest with people about what we know and what we don't know, I think being very honest about what is a, to use the policy discourse, a tame problem versus a wicked problem. I think, again, part of the way in which a lot of governments in particular lost public trust was through trying to present all of their policies, which were arbitrary, as being quote unquote led by the science. And I think that was problematic because while it looked as though they could justify their policies, actually, I think it made a lot of public citizens very cynical about their messaging because they could see that there were certain policy decisions that were arbitrary, right? And there is debate around it. And I think that's absolutely natural. There's not necessarily a right and a wrong way, there's trade-offs. But I think being honest about that and being honest about what we know and don't know actually is one way of building and earning people's trust. And there's nothing worse than people pretending they know things when they don't. I mean, it's the easiest way to lose faith in somebody. I think that was really important as a big takeaway. One thing I'd say as well is I think what doesn't work and what unfortunately I feel like we see far too much of online is mockery and ridicule. And I've tried to be very vocal about this because I see a lot, especially on Twitter, I see a lot of mockery around people who might have genuine doubts or concerns. And while that can be a very quick way to build an online following, because, for example, you can find like minded users who will defend you and like and amplify your message, I feel as though it's a bit of a cheap shot, because ultimately, if you look at the public discourse more comprehensively, what you're really doing is pushing people who have probably very understandable doubts further on the other side. And that's something I'm very concerned with. I think that there's a big difference between somebody who is strategically trying to establish influence online and promoting falsehoods, and those individuals should be quite rightly critiqued and I think that can be done in a way which again is tasteful. And when there's a lot of people who do this well, where the debunking takes the form of more long form blogs or vlogs, and people actually analyze where the mis or disinformation is. But I think these cheap shots, it's really something that if you think about the public good more broadly, it doesn't have any advantage other than getting people who already think like you to promote your message. And for me, it's really that group of people in the middle. I think people who were suspicious, maybe they took the first vaccine, but they were suspicious of boosters, or they had slight concerns in one way or another. I think they're the people who do need to feel heard. And even if they say something that might appear erroneous, there's no good that comes from mocking those people publicly and shaming them. So that's another thing I would say.
In the last couple of minutes that I have, what do you want to say to the public about this disinformation, this misinformation?
Right, that's a good question. I think I'd probably, just to be succinct, build on the last point that I said, which is be aware of our role in the public discourse. Even if you don't have a large online following, even if you just have a small group of friends, if someone says something that doesn't necessarily seem as though it's scientifically literate, the best thing you can do is ask them genuine questions, point them in the direction of reliable sources. Don't mock those people, don't ridicule them. It's just going to push them further on the other side. And if you think about when your own mind is changed, it's often when you're able to see the incongruity in someone's position. And I think really being there as a friend and ally for those who seem as though they're down the rabbit hole is the best thing that we can all do.
Thank you so much for joining me today.
My pleasure.